For many people, the hospital environment can be daunting due to the large-scale, busy, unfamiliar and clinical nature of the setting. The hospital experience can be harder for a person with dementia who may be living with a sensory, cognitive or physical impairment. In this regard, the physical environment of the hospital can be particularly challenging and can result in a person experiencing the hospital as a frightening, distressing and disorientating place. Not only is this highly stressful, it also contributes to poor clinical outcomes such as longer length of stay, increased medication, decreased mobility, health deconditioning and other negative outcomes. And when you consider that up to 29% of all patients in a typical acute Irish hospital may have dementia, then you realise that this has serious consequences for an awful lot of people. Taking into account Ireland's ageing population and that an increasing percentage of hospital patients will be older people, the consequences of a poor hospital environment will become an even greater challenge into the future. With this in mind, if a hospital is designed through the universal design approach, it can become a more supportive and enabling environment. Based on this approach, hospitals can be dementia-friendly if they are accessible, understandable and easy to use for all occupants. Recognise the cognitive, physical and sensory difficulties that a person with dementia may experience in the hospital. Reduce hospital-related environmental stress. Provide an enabling environment to account for dementia-related disability. Create a helpful and therapeutic setting to promote healing. And finally, recognise that dementia-friendly design not only supports people with dementia, but also supports accompanying persons, visitors and staff. Research shows there are several design issues that are important for achieving a universal design dementia-friendly hospital. These include supporting engagement and participation with friends and family, staff and the community, providing space and support so that accompanying persons can remain with the patient throughout their visit. Providing a people-centred environment that is human scale, less clinical or austere in appearance. This is also about recognisable design that is easily understood and intuitive to use, and opportunities to add personal belongings such as photos or objects. Supporting patient safety, health and well-being by providing a safe environment, supporting diet, nutrition and hydration, and supporting meaningful activities. Balancing sensory stimulation through maximising positive sensory stimulation while minimising the negative. It also means providing indoor and outdoor contact with nature and access to outdoor space. Supporting orientation and navigation through enhanced orientation to date, time, location, as well as improving spatial cognition and providing good wayfinding and visual access. Providing adequate space to support the specific needs of a person with dementia through space for personal belongings and adequate room for visitors. Space for retreat in multi-bed wards, and alternatively communal areas. Furthermore, a dementia-friendly hospital will also provide space and supports for physical movement, including safe and stimulating walking or circulation routes. And lastly, using appropriate technology for care delivery, safety, communications and therapy. A universal design dementia-friendly hospital reduces environmental stress and provides a more enabling environment in relation to disabilities or functional impairments. It also goes beyond these and starts to consider how the built environment can play a more active and positive role in providing supportive, healthful and therapeutic places and spaces for people with dementia.